Hey everyone, hello there. It's Dr. Gina, and I am pretty excited today to present on this topic. And I'm really most excited because this is the people that we just love to care for in our office, like mamas and babies. But that new mama, new baby, really that unique area is something that we're really passionate about. So, um, today I feel like this isn't a topic that gets a lot of attention when we talk about just stress and not realizing how much is really happening with the new moms and babies. So it's just a different perspective, and I just want to bring some awareness. And we're going to talk about actions and tips, but this is a really exciting time when you're a new mom. You've got your new bundle of joy with you. It's finally here, this squishy little baby, and so much focus is happening there, and rightfully so, because we've been waiting for this, and so is all your friends and family. But it's really not brought into awareness how much stress then that comes with this time, and especially for mom. So since we take care of so many newborns and those moms prenatally, we're first talking about this with our new moms. So whether you're like a new mama, it's a first time mom, or it's the second, third, maybe it's a new mama to be, but each new addition is going to bring stress, and it's just going to come kind of from a different perspective a little bit. So I really want to empower, and we'd like to support you at this time. And if you know people that are a new mom or going to be a new mom to be, make sure you share this information with them. Share this video so that they can gain awareness and they can get some tips and actions to be. I find that if people can be aware of the stressors that are going on or what they might going to be experiencing, then it's easier to take action or prepare for it. Okay, so that's what today is going to be about: awareness, action, and tips that you can do, because we want you to know you're not alone and that you're supported. So today I'm going to kind of break down those stressors into three categories. We're going to talk about physical stress, chemical stress, and emotional stress for mom and baby. And guess what? I'm going to talk about mamas first, because as moms, we never put ourselves first. So I'm going to do that. So moms, those physical stress that you're kind of under as a new mom. So let me see hand raise if it's, lack of sleep. As a mom, we're kind of in that mama bear mode, and our little ones are maybe sleeping 45 minutes, 1 to 2 hour stretch. You're nursing, then you're pumping, you're like cleaning bottles, change the diaper, and then as soon as you realize it, baby's awake and it's time to start over, you didn't even realize that 2 hours had passed, because you're in this total, what we call like mom fog, right? So you're just kind of rinsing and repeating that cycle. So lack of sleep is a big stressor. And then if you're not a first time mom, you got the toddler there too. Just with each new mom, there's just more life demands as a new mommy. And a lot of times that this isn't talked about. What about healing from birth? There's the physical trauma of the birth, and whether it was a vaginal birth, whether you had stitches, a C-section, there's all that trauma that's played in, and that's a lot of stressors on the body. Then you're trying to hold your baby while you're going through this healing process. You're carrying all the paraphernalia, like the diaper bags, stroller, car seat, maybe you've got your pump too that you're lugging along with you, but just all of this is going to come in. Then we have like breast size changes, right? Like I wasn't a busty person when I was like normally, and then when I had my baby and then milk came in, I was like, oh my goodness, what is this on my chest? So nobody told me that they were going to get this big, and like now what do I do? But in the office, we're going to call that like tension that moms get in the upper back. We call that the mom spot, because whether it's the breast changes, but you're carrying all that paraphernalia. In the late stages of pregnancy, we're getting more of that low back, pelvic complaints with our moms that are coming in. But the new mama, the mom spot, is that kind of neck, upper back, shoulder blades. And this is usually those like first couple weeks, because you're constantly holding that newborn. And even though the newborn may weigh like 6 to 8 pounds, when you're holding it all the time because you're just so excited to hold that baby, if you're nursing, you're feeding, you're constantly carrying that baby around, that puts a lot of tension and stress. So we see a lot of that upper neck and back discomfort or pain with the mamas. What about baby? Physical stress that the little ones are going through is, going to come from, like, partly that birth is going to be the big factor. I won't get into much like prenatal if we had some in utero constraint, but that can play into. But birth, whether it was a long birth, could have been a short birth, or C-section. So long birth, that's going to put a lot of stress and tension and strain. And as that baby's coming through the birth canal and that head's coming first, they're going to get a lot of jamming down into that pelvis. And if we have a long drawn out labor with interventions, that puts a lot of stress on those little guys up in that upper cervical. C-sections, we know that's going to be a lot of pulling versus the push stress, because they're going to pull and twist to get the baby out. And a lot of that stress comes in that upper cervical too. And what happens with this area, there's research that's been done, and it was called KISS syndrome. So it's a kinematic stress and strain of that upper cervical region, and it interferes neurologically. And we can see like reflux, nursing, latch difficulties, because we're going to get the jaw that ties into. So there's a lot of stress that comes with that birth for baby. And even short births, sometimes I'll kind of layer the stressors of birth, where we can have like a long labor, then we can have the short labor, and then the C-sections. But yeah, the short labors, because we're going to get all that for an 8 to 10 hour period. Now we're going to condense it down into 4 hours. So it's a lot of stress, compaction happening very quickly, very intensely. So we'll see like petechial hemorrhages with those short, fast labors with babies. So that can create a lot of stress and tension. In the research I was talking about, they said that 90% of births had this difficulty or had this syndrome, and that was 90% of what they would consider like normal, like births, not ones that were like long or a C-section. So there's a lot of those stressors that can impact the baby, and that kind of starts to kick that stress mode on with babies. Another thing with babies that they're like those physical stresses is they're having to adapt to that outside. Now there's that gravity world. They were like used to this like a warm little cocoon that they're in, hearing mama's heartbeat constantly. Now they've got bright light, noises, clothes on their skin. It's dry. They're having to breathe externally, and breathe on their own and eat on their own. This kind of starts to kick that stress mode on in infants. And you can think about it this way as the analogy, like if you can remember driving on the freeway for the first time, and that was super stressful, right? Like you're like tense, white knuckling it. Everything was happening so fast. There's just so much information you're trying to take in. So that's what these little ones are going through. It's like all of a sudden, whoa, out of the womb, I just had all that, had to come through the birth canal that kicks that nervous system on, but maybe there was a lot more difficulties, interventions, I got pulled out, or I had to be cut out. All those things are a stressor. Now it's like bright lights, all these things happening. What happened to my warm little cocoon? I know we kind of don't think about it that way, but if their system is getting stuck into a stress mode often and in the beginning, and this is why we get so excited when our moms that we cared for with pregnancy, they're going to bring those babies in for those first post adjustments, so we can just help calm that nervous system, kind of get it back and like help it reset to get into that calm, that rest, that sleep mode, that digest mode. Because when that system gets stuck into that stress mode, and it kind of starts to persist, like what does stress look like in a 1-week-old? It may be that they're uncomfortable, nursing is difficulty, or they're having latch difficulties because they can't get their jaw open enough because they're kind of tight and tense. or there was trauma during that birth, they're holding their head up right away. That's a lot of tone and tension. In a 3-month-old, if that stress has been stuck on, we're starting to see that colic, reflux, constipation, because the body's stuck in stress mode. We're not into like the rest, the digest mode. And we'll be having an upcoming webinar on that colic and reflux in 2 weeks also. But what if it gets stuck on in a 5-year-old? That stress could look like attention, focus problems, maybe hyperactivity, that go, go, go mode, even into like teenage time. And we'll talk about this perfect storm. You hear us talk about that in our office. But when it gets stuck into like a teenager, we're going to see more anxiety, depression, and this is all stress gets stuck on. So this is why it's really important that we talk about and bring awareness to this so we can start to reset it from the beginning and not have it stuck and have it stay there and start to develop into other challenges. So what about like emotional stressors for mom? A lot of times you can just see it on the new mom's face. You know, they're trying, or we think that we have to do it all. And then we start to get the mom guilt because maybe our other relationships, we're not feeling that we're giving enough to, whether it's, you know, our spouse, our other friends, our families, our other kids, whether we have a toddler or maybe we have multiple kids at this stage. We've just got so many plates spinning and we start to feel guilty that, how do I do it all? How do I give to everybody? And this is how we're going to talk about why this self-care is so important. Like there's all these things that we're supposed to be doing, cooking, cleaning, and we all put it on ourselves that like, I have to be the perfect mom. So what about, we've got the hormonal changes, and I'm going to talk about that more in the chemical stress section, but we've got the chemical imbalances, the changes that be happening that can kind of lead into anxiety and depression because we're going to have this big hormonal change. So it's going to be really important as moms that we kind of start to realize this early and start to think about like that self-care for us and not get into that stress mode because the baby's nervous system is your nervous system. So I'm going to kind of start to bring that in as we talk about baby's emotional stress. So we talked about kind of this big change for babies going from that nice cocoon into that outside world. Maybe if they were like stuck in the NICU for a while, that was a lot of emotional stress. But babies' emotions are still really connected to mom. Like we're still kind of really one. And a lot of times as moms, and I can even remember myself when being a new mom, like you're not really realizing all that stress and tension that you're holding or that you're carrying is being like reflected into your kiddos and like the newborns, especially because they're still us, but even our other kids. So the babies, that emotional stress, bonding is really important for them. They get our scent. They don't see as well. They're not used to our voice maybe externally quite yet. They were hearing it internally. So that's a lot of times why they'll want to sleep on our chest. So how we're feeling, mom, is really going to affect how the kids are feeling. So not to put more guilt on us, but kind of more as the awareness. Whether our friends, because this is going to be big support. So maybe you're a support for a new mom. Like it's really important that we have our tribe around us. And this is why in our office, we really love this demographic. We love taking care of like our pregnant moms, our new moms, because we really feel that we can impact your world and then impact your child's health. So that's why it's just such a big passion of mine, and my team I have in place is always really important for us. What about that other emotional stress with babies? Like they really can't tell us how they're feeling, but they show us. So if you've got the baby that's like fussy, they can't calm, they're reflexy, they're gassy, or they're stiff, like they're always pushing away. Remember, they can't tell us, but they're showing us that they're stressed. So if you have one of those little ones that you think is stressed, call us. We can really help you with that. And also remember, like each child's going to be a little different, because not only is each child different, but we're different with each child that we have. I can remember like my daughter was sleeping through the night by like 3.5 months. And then her brother it was still, he was close to a year and still not sleeping through the night. So, I had to kind of reflect back and think of like, okay, what's going on different in his life, our life, what's going on with me. I think I was busier as a second time mom. I was in practice. My practice was busier, so I wasn't as present probably at home. So trying to look back and I always share those with my moms in practice. Like, we can't have that mom guilt because we're going to do it the best we can, and we learn each time as we go. So what about some of the chemical stressors? We talked about physical and then the emotional stress. What about chemical stress for a mom? You're going to have those big drastic changes in those hormones. We get that huge drop, and this is why a lot of moms now will use that, get their placenta encapsulated, because that's going to help level out that hormone, like kind of real crash and surge. And oftentimes, since we see our new mamas and babies so much, we get to like see this and recognize some of this challenges with moms, and we can really help them with that. Also, as a new mom, if we're stressed, those chemical stressors, also our milk supply can be impacted and our production could go down. So if you're noticing some changes in the milk production, then it's a good time to reevaluate some of the stressors that could be impacting our milk supply. So what could that be? Maybe we're having too many visitors. We're not kind of setting those boundaries. Maybe we need some people to help with some of if we have older kids, our toddler, or maybe even with the newborn, if they're not sleeping enough and then you're not getting good rest, maybe there's somebody that can come over and help you out. This is where the friends, they would love to hold the baby, right? So maybe you've got some kiddos around. I know in our current environment where we're having to social distance right now, it's hard with that. So just being creative. Or I know I've had moms in the past with, if they've got a toddler and they're not getting enough sleep and the baby is sleeping, but how do I like rest when the toddler's going? So they'll like take a room where they can close the door, lock themselves in with the toddler, and it's a safe room, whether you're just sitting and having quiet time with the toddler, like reading, but maybe you can catch a little shut-eye real quick there, or it's just having quiet. They can sit and they can play and they can draw, just knowing like it's quiet and time now while the baby's sleeping. Another thing is like if you're not getting enough food, that can decrease our milk supply. So having people help us with meals, like either you're getting your groceries for you or cleaning, making sure you're getting enough water. So those stressors can have different impacts on us. So the chemical stresses are really, that's a really huge one to recognize because of the hormone crash, and we don't want to get into like those depression modes. We want to be aware of that. So it's really important for our circle around us to help us with those things too. So what about some of the chemical stressors for babies? So a lot of times we'll have like the post-labor and delivery. Babies can be like sleepy, a little withdrawn, maybe just sort of out of it. And this is oftentimes when I get my babies coming in early after birth for their like checkups from moms, or to get those next check to make sure that they can nurse and latch. But if we've had a really like traumatic birth, high intervention, maybe they were like had 2 epidurals because the first one didn't take, there was more just medication. A lot of times we'll see those babies like sleepy. So that's just another stress. And we have to also remember that newborns especially, but even those first, like infant stages, those first few months, baby's digestive system still isn't really developed. So if we're having to add formula in, or maybe even mom's nutrition, they're eating some harsher foods or processed foods. So that's going to impact baby's like gut and ability to digest properly. So that's just some added stressors. And if we're trying to change formulas because we're trying to figure out what's right, we got to give them time to adapt and just like kind of get used to, and their system to develop into it. But today I really wanted to shed light on these new stressors, or like not just new stressors, but stress that can be on mamas and babies, and just make you aware. But I also want to give you some tips and tools. So I got 4 tips for you. One is don't be afraid to ask for help. I know a lot of times I feel like I just got to do it. I can handle it. I can do everything. I'm super mom. But, you know, the strongest moments is when we are the most vulnerable. So if we can ask for help, because people truly want to help us, especially if they've been a mom in the past, they know what you're going through. They know what the struggles are, even if it's a little different than yours. So don't be afraid to ask for help. You can call our office too, whether you're part of our tribe or not. We want to help you because we know that the better off that you and your newborn and your infant are in that early stage, that's going to help set the stage for a good, healthy, thriving life. So take care of you. So much focus is like on taking care of this new little one. A lot of times moms, and we continue this through our children's life, don't take care of ourselves. And you got to remember, you can't drink from an empty cup. What do they say on the airline? You got to put your oxygen mask on first before you can help somebody else. So as moms, it's so important for us to put our oxygen mask on first. And we love to be part of your tribe and help you so we can help you be the best mom and the best version of you possible. Another big one is trust your mom gut. This is your intuition. Something that I've always talked to my patients about. Like if something just doesn't feel right to you, whether it's my baby just doesn't feel right, I need to call the doctor, I need to get somewhere, or my friend's telling me this, but maybe that just doesn't sit right with you. It's just not what you see as a mom. So you can take other people's advice, but listen to your gut. What feels right with you? Talk to your spouse, talk to your partner, see if that's just really what's going to matter, or that's how you want to parent and raise your child. Because sometimes other people, they have best intentions, but maybe that's creating more stress. So just kind of sit back, trust your gut, trust your intuition, and the more you start to trust it and listen to it, the more you're going to hear it and be able to trust it and listen to it as you progress along this parenting and motherhood journey. Also, it takes a village. And I feel truly blessed to be part of this journey with you, whether it's through the video or you're in the office. We're grateful to be part of your team. And if you are looking for more help and you think you've got a stressed baby, or you're finding yourself in a lot of stress in this new parent mode, go ahead, call us, reach out. Whether you reach out in personal, message us, give the office a call. We would love to be part of your team and tribe. All right, we look forward to seeing you again soon. And Dr. Gina here with Inspire Life Chiropractic. I hope you guys all have a blessed day.